Stephen, quite a setback just when the industry's starting to crank up again.
Oh, especially on the back of Melbourne, Kieran. We've come out of a big lockdown in Melbourne. We're now faced with Sydney, so our two major capital cities in the last month will now have been locked down. I mean, that impacts probably about 10 million people all up. In the accommodation and food service sector, there's 1 million people employed in Australia, about 90-odd thousand businesses. If you're looking in Sydney, that's probably 400,000 people. With those types of restrictions that are in place today, getting into a weekend, getting into the school holidays when you'd expect things to crank up, that's a significant knock-on to business income and people's wages.
My colleague Andrew Clennell reporting and uncovering some really interesting news, quite concerning in New South Wales, where the public health order didn't require the limousine driver, who was the source of this latest outbreak, to wear a mask when ferrying frontline, airline staff, airline crew. It's inexplicable, really, in a state where they've done pretty well in managing COVID.
Oh, Kieran, that's one of the sort of confounding things in this, that I think if you'd asked the man in the street, would you have thought that a limousine driver taking airline crew to a hotel would have been vaccinated? Every person in the street would have said yes. We've since found out that there's a problem apparently at National Cabinet. This can't occur. I mean, you need a driver's licence to drive a car. You need responsible service of alcohol certificate to work in a pub. I don't think it's too hard to say to the Australian population, if you want to work as a frontline worker, whether it be in hotel quarantine, whether it be in aged care, that you must be vaccinated.
Well, when you look at all the other efforts that are and expenditure, like the quarantine for returned travellers, like we spoke to Andrew before,
yes.
He's undertaking, the Prime Minister's undertaking all these efforts, but yet one slip up, like a driver with air crew not being vaccinated, first of all, in his 60s, and not being required to wear a mask. It's hard to get your head around.
We've asked National Cabinet for about the last 12 months to measure what's best practice. So to work out what are the 10 or 20 top things that we need to do to keep Australians safe, especially looking at that frontline staff, those people that are greeting people, getting off planes, that likely have, many of them have COVID. We don't have that measurement of best practice. That requires the agreement of the states to simply say, okay, what are the things that the top 20 things that we need to do to keep us all safe, and tell us, and to say these are the things that we all agree on. And we don't have that at the moment.
Another area of great challenge for your industry at the moment is to get people in to work, not just customers, but the staff.
Yes.
A huge shortfall in terms of cooks, chefs.
Oh, we're down about 8,000 chefs. Any day that you can jump on seat, you'll see that 8,000 chefs. We have 8,000 vacant chef positions. The federal government yesterday made a wonderful announcement which allows chefs to be added to the priority skills list, along with nurses and doctors and other people, and they'll be able to come to the country. Now, the great benefit of that is that we have wonderful Australian chefs here in Australia, where people learning the cooking trade, but being able to bring in skilled migrant chefs and to pass on their skills and to fill in gaps that we don't have, that will enable us to be part of the global competition when the economies open back up again. We're in a global marketplace. And we have the best food and produce in Australia, and these people will help us.
Well, that's encouraging. Hopefully, when that happens, that border reopens. Stephen Ferguson, I very much appreciate your time. As always, thanks so much for that.
Thanks, Kieran.